Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers, producer of Public Health on Call. Today, a special episode on human rights in the conflict in Israel and Gaza. Len Rubenstein is a distinguished professor of the practice and interim director of the Center for Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health. He speaks to Dr. Josh Sharfstein about the Geneva Conventions and the rules of war, what they require, when they apply, and whether they're being followed. Let's listen.
Len Rubenstein, thank you so much for joining me on Public Health on Call to talk about human rights law and the conflict in Israel and Gaza. Let's start with just maybe introducing you again to our audience. We've had you on a couple times the last time to talk about attacks on the healthcare system in Ukraine. But tell us a little bit about yourself.
I'm now interim director of the Center for Public Health and Human Rights at the Bloomberg School and professor of the practice there. And for the last 25 years, one of the major areas of my work has been the protection of healthcare in war. And I've done human rights reports when I was at Physicians for Human Rights and have engaged in a lot of research on the problem. I started a coalition to help mobilize the international community on protection of healthcare in war. And a couple of years ago, I wrote a book on the subject, Perilous Medicine, the struggle to protect healthcare from the violence of war.
Now, you've worked all over the world. Is that fair to say?
Yes, I've done work in Syria, in Chechnya, in Afghanistan, in the Balkans, and other places around the world.
So you bring all that experience to this question of the crisis in the Middle East. I want to ask you first about the rules of war that apply in this situation. How did they come about?
The rules of war go back to the mid-1860s, the first Geneva Convention, which was adopted to protect wounded soldiers in war and to allow volunteers to come on the battlefield, to serve them, to protect civilians who treated them in their homes, to protect medical personnel, and to protect hospitals. So that was the very beginning. And over time, the Geneva Conventions have evolved very dramatically to expand protections from international wars to civil wars, from soldiers to civilians. And so now the rules are very extensive, and they are one of the most contained in the most frequently ratified treaties of all international treaties.
So talk me through some of the core elements of where that law stands today. What is permissible and not permissible in war?
The basic idea of the Geneva Conventions is to avoid unnecessary suffering to people who are not fighting. That is, civilians, wounded soldiers, prisoners of war, and others who are not in combat. And to do that, combatants have to distinguish between military targets and personnel and civilians. They are not allowed to deliberately attack civilians. And beyond that, knowing that civilians can be harmed even when there are military targets, there are duties to prevent or avoid or at least minimize the harm to civilians in the conduct of military operations.
What about critical infrastructure for civilian populations like water or energy?
The rules apply to structures and other infrastructure. So, for example, you can't target the power grid or the water supply. And we've heard, for example, condemnation of Russia for targeting the power grid in Ukraine. And so you need to respect both structures, civilian structures, houses, hospitals, and other civilian infrastructure, as well as the utilities like electricity, water, fuel, and the production of food.
You described the origins of the Geneva Conventions in healthcare. And how specifically do the rules of war apply to healthcare institutions and healthcare services?
There are two fundamental obligations. You must respect and protect healthcare. Respect means don't attack them, don't inflict harm on them. Protect means you have an affirmative duty to do all you can to make sure it is not harmed or damaged. And that includes both the hospitals and other clinical kind of facilities, as well as medical personnel and the wounded and sick themselves.
Let's start with the attack on Israel by Hamas. How does that relate to the rules of war?
The Hamas massacre of Israeli civilians, the sexual violence against those civilians, the taking of hostages by Hamas, the desecration of bodies of people they killed are not only horrific acts, but they're criminal. They're war crimes, and they're likely crimes against humanity because they were widespread and systematic. In addition, from the beginning, from October 7th on to today, Hamas has been firing rockets indiscriminately into Israel. And because they're indiscriminate, they are not distinguishing between civilian and military targets, and they too are war crimes.
Thank you for that description. And would it be fair to say that these violations of the rules of war by Hamas are ongoing?
They are. And not only are they continuing to fire rockets into Israel, but they're holding 137 hostages, and they embed their military operations in and under civilian structures, including hospitals. And that is a violation of the laws of war.
Thank you. I now want to turn to Gaza and Palestinians in Gaza. What is the situation in brief facing them today?
First, we have to recognize that more than 18,000 Palestinians have been killed in Gaza. A recent study by the Israeli newspaper Haaretz found that even taking into account possibly confounding factors, 61% of the casualties in Gaza are civilian, far higher than in past conflicts. And just to make this a little more concrete, 300 families have lost 10 or more family members in bombings. Almost 300 health workers have been killed. People who are sheltering in UN, UNRWA facilities for people who have been displaced have been killed. More than 300 of them have been killed and almost 1,000 injuries. And these are in places designated and known as shelters. And just last week, 2 mothers in a maternity hospital inside the hospital were killed.
What about the situation with critical infrastructure and necessary resources?
60% of the housing in Gaza has been damaged or destroyed. Only 13 of 36 hospitals are even partially functioning and not very well. And most of those hospitals are in southern Gaza, which are mostly community hospitals who have little capacity for surgery for complex traumatic injuries. Just last week, there was bombing near 2 hospitals in the south. And there are almost 2 million IDPs, meaning internally displaced people. And they're living in terrible conditions, severe overcrowding, lack of sanitary facilities, disease outbreaks, diarrheal diseases, skin infections. They have to wait hours for food, and the World Food Program did a survey which found that 90% of those surveyed went to bed hungry, and 63% endured no meals for entire days. And still, only 100 trucks a day are getting in compared to 500 before the war.
And we've seen reports from aid agencies that the humanitarian crisis is as bad or worse than they have ever seen.
Yes, it's people are running out of words like cataclysmic or catastrophic. And we have to remember that there's no place safe for Gazans to go. They can't leave. And when they went to the south, the conflict moved to the south with them, especially after the end of the ceasefire.
Now, the question I have for you is Israel's conduct and the rules of war. Is Israel violating the rules of war?
The evidence to date suggests that they are in multiple ways. Of course, investigations are needed to definitively make conclusions, but we certainly have sufficient indications that there are many violations, in fact, daily violations of the laws of war.
Can you explain a little more what you mean?
Well, let's start with the duty of proportionality, which, as I mentioned, requires looking at whether excessive harm to civilians outweighs the military advantage gained. And the important thing about that rule is you have to make that assessment, the expected harm in every attack. But what Israel appears to be doing is looking only at its strategic goal, that is, eliminating and eradicating every aspect of Hamas's infrastructure and its fighters. And when it does that, it then claims that that military advantage of eradicating Hamas is so great that any harm to civilians is not excessive in comparison to achieving that goal. Basically, that approach swallows the rule because the goal of winning the war will, if that's the standard, it will always allow massive civilian harm. And that's why the law doesn't approach it that way. You have to look at it target by target, objective by objective. So we have examples where Israel attacks in a whole apartment building and they assess that it will kill dozens or even more than 100 people to get at one fighter, even a low-level fighter. And that means that its interpretation of proportionality is both inconsistent with the law, but seriously undermines it because it would allow any level of civilian harm.
What about attacks on infrastructure like water, power grid? How do you see those?
What the law is clear that you have to maintain and not attack infrastructure that's critical to the survival of the civilian population. And whether it's a physical attack or simply denying water or other necessities doesn't really make any difference. There's also the duty to minimize harm, which we haven't yet talked about, and that requires adjustment of the means and methods of warfare. That means the weapons you use, whether it's an airstrike or a ground attack, and in the course of any attack, taking specific steps to try to avoid or minimize harm. And there doesn't seem to be any indication that Israel is doing any of that. Instead, it cites its warnings, which is a separate requirement. But a warning and evacuation demand is not a substitute for taking those precautions and the means and methods of warfare. And the result of that, in my view, is that it is committing violations and it is causing untold civilian harm. We can see this, too, in the way it addresses hospitals. Israel claims that Hamas is embedding in hospitals and under hospitals, and that converts those hospitals into military targets, and that therefore they lose protection. But even so, they have a duty to protect the wounded and sick. And the evidence is that they have not done so. In the hospital attacks, we know, for example, in the infamous now Al-Shifa hospital attack, for days before the assault, while it was under siege, the hospital lacked water, emergency fuel for generators had been used up. People were dying in the hospital. And when Israeli troops entered, they didn't make any serious effort to address that crisis. What they did was they released a video showing boxes of medical supplies being brought in and later incubators, but that was not sufficient or even close to sufficient to address the crisis in the hospital.
Len, let me ask you about one other dimension of healthcare, which is medical evacuation. What do we know about the situation there?
The rules of war, of course, require safe medical evacuations, and the Israeli military has arranged those kinds of procedures in past wars in Gaza. But it's now completely broken down. There has been very little cooperation, coordination by the Israeli military to assure that evacuation, and people have died as a result.
Len, what about this question of inadequate humanitarian supplies reaching Gaza? Does that relate to the rules of war?
Yes, there is a duty to allow passage of humanitarian aid. And that has been an issue from the first day of the war, and it continues today. Before the war, 500 trucks came into Gaza bringing food and other kinds of necessities into Gaza because there's a blockade, and the only way to get the supplies in was through these trucks. Now, only 100 trucks are getting in when the humanitarian situation, the medical needs, the food situation, the water situation, the fuel situation is exponentially worse than before the conflict.
So I am hearing you find significant violations of the rules of war by Israel in this conflict. I know you've expressed that view, and you've expressed your view about Hamas in multiple articles, in public discussions at Johns Hopkins and elsewhere. And I wonder if, before we end, I could just ask about the reaction that you've received, and in particular, any pushback you've received from different quarters.
I think most people who listen to what the law says and what the conduct has been on both sides appreciate that these are very serious issues. I have heard from people supporting Israel that it must defend itself. It must take steps to eradicate Hamas, and they have to do it by any means necessary. But that is not consistent with the law. The Geneva Conventions were designed to forbid using the standard of any means necessary to win the war. There were theories at the time the Geneva Convention was first adopted that advocated that approach, but that was rejected. So I think people can support Israel, but demand that it comply with the rules of war, because if they don't, we see the horrific consequences. One of the things I've heard from people concerned with the level of Palestinian death and suffering in Gaza is that we can see what's happening and we don't need to do anything more to draw conclusions. But if Israel is going to be held to account, there have to be investigations. There has to be analysis of the law to sufficiently prove violations. And that's why we have to take that approach.
Len, you have worked during so much of your career to protect civilians and healthcare in times of conflict. I can only imagine how frustrating this is for you to see what is happening.
It is difficult. It's depressing and disconcerting and brutal. It's the same year that we've seen deliberate attacks on civilians and hospitals, in fact, over 1,000 in Ukraine. And the vitality of the Geneva Conventions is itself at stake, as well as the suffering of people in this war. So I can only hope that this conflict will come to an end, that perpetrators of crimes will be held accountable, and faith in the law can be restored.
Len Rubenstein, thank you so much for joining me on Public Health On Call.
Josh, thanks for having me.
Public Health On Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.